Hi, I'm Jeanne Schumacher, the plant-based
Hi.
queen of diamonds, and my partner is Nancy Mathews. She is the plant-based queen of hearts, and together we are two peas in a pod living a plant-based lifestyle. Nancy is a plant-based lifestyle coach, and she can be found on Facebook through Plant-Based Chico, and you can connect through Facebook with her. And I have a new website called simplyplantbased.net. And I have a new program to help you continue your education because it is key to continue or keep educating yourself. And tonight we have Dr. Debra Shapiro. She is a gynecologist who just happens to be plant-based. She's done the Main Street Vegan Academy, the Health Coach Institute, and she's got her plant-based nutrition certificate through Cornell University. So Dr. Shapiro, welcome, and thank you so much for being here tonight.
Oh, thank you so much for inviting me back, Jeanne and Nancy. It's such a pleasure to talk to you guys. I love it. It's wonderful. I love meeting with people in your community.
We are so happy that you're here with us. It's a true honor.
Oh, very sweet. The honor is mine. Very nice. Thank you.
Well, we're going to jump in because we had a ton of questions that we just never got to.
Right.
So the last time. And if you have questions tonight, go ahead and post them. Do take a minute and please share this on your timeline because we would really appreciate it because let's help get the message out, okay, about plant-based living and how we can change our health destiny by going plant-based. So Lorraine Sire, who is a Simply Plant-Based member, she asks, what helps nausea? I mean, I'm assuming she means pregnancy, other than ginger or herbal teas?
Yes. So it's recommended that we try vitamin B6, 25 milligrams 3 times a day. Now, this is very standard, and I know it seems, why would doctors be given vitamins? But they actually do. We recommend extra B6, and we know that people are usually already taking prenatal vitamins, but extra vitamin B6 seems to help with nausea and vomiting in pregnancy. So if it's not too bad, if you can hold something down, then it's vitamin B6, 25 milligrams 3 times a day. You can also add to that a medication, an old sleeping remedy called Unisom. So they actually make these medications that have Unisom plus B6.
I've never heard of that.
Yes. And in addition, you can use those anti-nausea, I guess they're motion sickness wristbands. It might help. You can eat very plain foods, eat foods that don't have a lot of smell. I mean, I have to say most plant foods don't have that much odor, but sort of simple plant foods. Getting up in the morning and immediately having some plain crackers that just might settle your stomach a little bit. But nausea and vomiting, hyperemesis gravidarum, or nausea and vomiting in pregnancy is related to the hormone of pregnancy directly affecting the nausea center of the brain. So it is seen less in plant-based eaters than in meat eaters.
Really?
Yes. Might be the saturated fat, actually, the less saturated fat in the diet, I believe, but I don't think it's related to the protein content of the food, but the kind of animal protein versus plant protein. I think it's more of the saturated fat. But so there is less of it, but it can still be an issue, and it can be very serious. So
Excuse me one moment, ladies. I need to take a phone call.
Okay.
Usually it's better by about 14 weeks. So if you can hang on, it usually gets better. But the B6 works very, very well, the vitamin B6, 25 milligrams 3 times a day.
All righty. Well, her next, Lorraine continues to ask, she says, she wants to know how to ensure you're getting enough caloric intake for the fetus, and what are the best foods to eat during pregnancy?
This was a terrific question, and thank you, Lorraine, for asking. I know you're an RN, so Lorraine out there, thank you for all the work that you're doing. So my guide for this is really Brenda Davis and Vicente Molina's book called Becoming Vegan. I actually have it. No, I had it, and I don't have it at the moment. I could go get it. So she has a whole chapter in that book. It's a fantastic reference. If you care about nutrition more than the average person, then you should have this book as a guide. Another one that's really terrific, of course, is Juliana Hever's The Complete Idiot's Guide to Plant-Based Nutrition. So I really like both of them. So I'm not playing favorites. But I know that Brenda Davis has a whole chapter on being pregnant and raising vegan babies and vegan kids. which, did you hear that our Prince Harry and Meghan Markle are going to raise their child vegan?
I know. I
Isn't that
saw
great?
that.
It's so exciting.
I am very happy.
Yes.
That right there, that's setting a trend
Oh, yeah.
that,
Yeah.
you can't ignore that.
No, and I think 1 in 11 Britons now are vegetarian or vegan. It's really incredible. They're really taking off. But back to the question. So in this book, Becoming Vegan, there's a chapter on pregnancy and childbirth, and I highly recommend anyone who's pregnant or thinking about getting pregnant to look at that. And the other really great reference is Dr. Greger, of course, from nutritionfacts.org, and he talks about how, detoxing from fish before and eating organic. And I've done a little bit of research looking at some of the data that he was talking about. It's really amazing how many chemicals that we're exposed to. And so I would definitely think about detoxing from fish. I had mercury poisoning twice just from eating when I was being pescatarian. So, but your people are already vegan, right? So they're already plant-based, so we don't have to really.
We're assuming everybody's plant-based.
So we've already detoxed from fish. We're not eating fish. But then when you're thinking about having a baby, I would definitely try to eat organic, because what's been shown is that when people have a higher load of pesticides and fungicides in their blood, it goes to the baby, and it actually decreases the birth weight of the baby. Not good for the baby. So I won't talk about mercury and all those other chemicals that are in fish, because you're not going to be eating them, which is terrific. But you do need, so there are a couple things that you actually do need, and the book is very clear on this, but initially there's a little bit more of a caloric need in the second trimester. It's like 300 extra calories. It's not much. It's really not much. A couple glasses of soy milk and you got it. But the protein requirement goes up by 50% in the second trimester. And Brenda Davis's book is terrific because she actually gives sample meal plans. She's basically just adding a protein-rich food at every meal. So you're not just having a plain big salad, you're dumping some beans on the salad and you're having your quinoa on the salad. So you're just eating more protein-rich food, 3 meals and snacks. And then you can do it. You can absolutely do it. And the other things that you do need for the baby's brain is omega-3s. Omega-3 fatty acids, that's alpha-linolenic acid. This is an essential fatty acid. There are 2 essential fatty acids. There's alpha-linolenic acid, which is an omega-3, and there's linoleic acid, which is a omega-6. It's very easy to get the omega-6s. They're everywhere. They're in nuts and seeds and oils, but we don't get enough omega-3s, and we really need that for the baby's brain development and also for our brain to protect us against Alzheimer's as well. So an algae-based omega-3 is good. And as a matter of fact, some prenatal vitamins already have a separate capsule of omega-3, and they're usually algae-based. They're not using fish oil in these prenatal vitamins. The ones that I've seen have not been fish oil. And again, I would not know when to use fish oil. You're all going to use algae-based or microalgae, and that's where the fish get it anyway. So if you're talking to a non-vegan, you can always remind them that the fish don't just make omega-3s, they get it from the algae. Everything comes from plants. So an algae-based omega-3 and about 250. The reason I would get, so when you take it in as a microalgae, you're actually getting the preformed DHA and EPA, which is what your body would turn the omega-3s into. But we don't always convert it that well. So that's why it's good just to get a little extra. I mean, you should certainly eat your walnuts, eat your hemp seeds, eat your chia seeds, eat your flax for sure. But you could always take a little extra when you're pregnant. And preconceptually, make sure that you get enough folate. And you could add, certainly most people are just taking a prenatal vitamin, and most of the prescription prenatal vitamins have 1 milligram of folic acid. But you can also take just over-the-counter prenatal vitamins that have about 800 micrograms of folic acid. It would be it's fine to do that. But there are people who really believe that it's better to use folate instead of folic acid. Folic acid, if you took it for a long, long time, might even increase your risk of some cancers. But folate, so you'd need 400 to 600 extra micrograms of folate in food. And it's found mainly in beans and greens. And again, looking in her book, she has tables of food and how much folate is in all the foods and all the vitamins that are in all the foods. So you really can't go wrong if you're following along with with her meal plans and all of her data.
Well, that's one of the questions Lorraine continued to ask. She had several in this. Was she wanted to know, are prenatal vitamins necessary? So, I mean, if you're eating a plant-based diet, is it really necessary?
Necessary. I am an OBGYN, board certified OBGYN. And ACOG really does recommend prenatal vitamins. I think in truth, if you feel that you can get all the nutrients, there are nutrients of concern and you don't want to miss out. So there's iodine. It's so important to get, if you can use iodized salt, if you can take a pinch of salt, iodized salt, but you need a reliable source of iodine. Otherwise, the baby will develop something called cretinism, right? That came from iodine deficiency. And it's unnecessary to have any deficiencies in your child nowadays, right? Because we have everything. So I know you're already taking B12, the omega-3s. You can get iodine, zinc would also be of concern. You can read her chapter. I think you probably can get it all in food if you eat well and you eat a variety of foods and lots of protein-rich foods and lots of different kinds of foods. But I think it's easy enough just to take your prenatal vitamin while you're pregnant.
Okay.
I don't know if that's the answer she wanted to see. Let me see if I saw anything else, if I had written anything else. I mean, yes, what I wrote, if you love all kinds of plant foods and you have time to eat a wide variety of plant foods and lots of them every day, and you're taking your D and your B12 and your DHA and EPA, and you're taking your zinc and you have a reliable source of iodine, then you'd probably be okay. But it's certainly easy enough just to take that extra prenatal vitamin.
Okay. Well, good to know. Laura Wing, who's also a Simply Plant-Based member, she asks, what are some non-surgical birth control options for fibroids that developed on a vegan plant-based diet? She's not eating any dairy at all. So.
Right. And so fibroids that developed.
How long would it take a fibroid to develop?
I think because I've watched fibroids grow.
Right.
And they grow until menopause. They can definitely grow about 2 centimeters a year.
Okay.
1 to 2 centimeters a year. I've seen rapidly growing fibroid is a reason to be concerned.
Right.
So I don't know whether this person has so they feed on estrogen, on your own endogenous estrogen. I don't know if this person has some extra weight, so maybe her endogenous estrogen is high. You could certainly add some flax seeds because
well, wouldn't you be also concerned about things like parabens?
Yes. So yes, obviously.
You want to make sure that
other forms of xenoestrogens that are in your environment, any kind of chemicals that would mimic estrogen in your body.
Right.
You want to clear out. So eating organic and avoiding plastics, microplastics. You know as much about this as I do, certainly. So, but I would be concerned. There may be functional medicine doctors that might have some other ways of looking at this, but I really only know about flax. Now, phytoestrogens, like in soy, they do not cause fibroids to grow. They're not going to cause. They're not like so this is interesting because it's like an anti-estrogen in the breast. Soy is like tamoxifen in the breast, but much like tamoxifen, it doesn't really do much in the uterus. I mean, tamoxifen actually is a weak estrogen in the uterus. And so what I've read is that the soy phytoestrogens will not cause the fibroids to grow, but it will not cause them to shrink. And they won't shrink until menopause, really, until your estrogen levels really drop. So I would look for places where you might be exposed to endocrine disruptors.
Mm-hmm.
And
that'd be like phthalates. There's a ton of those in your environment. Just like, for example, the shower curtains, right? That the plastic, the phthalates make the plastic soft,
Yep.
The BPA is going to make the plastic hard, right? Mm-hmm. But the soft plastics, and they were even, very concerned about even babies, like a lot of the baby toys were like they were sucking on these toxic lollipops, because basically they were chewing on phthalates, which is what makes the plastic soft, which just makes me cringe. But there's a lot of these phthalates that are in our environment that we just don't even know about, like the paper from the receipt.
Yes, I was just going to say that, that contains BPA as well. So I know if you have a job where you're handling receipts, I would wear gloves, right? And I would add some extra flax because, a couple of tablespoons of flax seeds could help to remove some excess estrogen as well. Okay. But just I was just say, if you have fibroid that is growing when it should not be growing, I would get that checked out. Just watch it and see if it's rapidly growing, I would get help.
I know Dr. Goldhammer talks a lot about fasting to help with those fibroids, that's a way to help dramatically reduce them very quickly.
Right.
And, he's had a lot of success with that. So.
Yeah, so that would be something to think about too if you have the body type that can handle some fasting. I mean, if someone's already quite slim, then I don't know if they can handle long-term fasting,
Right.
but I don't know how long it would take, but yeah, it's something you could even have a conversation with Dr. Goldhammer. You can call up and have a conversation to see if you'd be right for some water-only fasting.
And you need to, if you're going to be doing it more than, like, say, a weekend or something, you definitely need to be under a doctor's supervision, because there's just a lot of things that can go, not wrong, but things that you don't anticipate. You don't realize that the body's trying to heal, and in this healing process, you're going to be dumping a lot of these toxins, and how to be ready for that mentally, emotionally. So I think there's some, a lot of different aspects of the water fasting that you definitely want to be doing it under a doctor's supervision.
Because also, not only do you fast, let's say you go to fast for a week or something, but then you also need to refeed very slowly. They take about half the time that you fasted to refeed.
Right.
So plan on, sort of a week and a half if you're planning. The other thing about these fibroids is they will continue to grow until menopause. I just want to tell you, regardless, they will continue, because you have estrogen. If you have estrogen, it's not about being vegan or not vegan. If you have estrogen, which I do if you're a woman, or a trans man, but if you have estrogen, then these fibroids are going to grow. So if you have fibroids, even if you shrink them, so we could give you medicine that will shrink them, but then they will grow again. So that's what I'm wondering about it. Does he get them to shrink and not regrow? I don't know.
From my understanding, but this is a great question. What happens? Okay, let's say you had them surgically removed. Would they continue to grow back?
No. If you have them surgically removed, then they're gone.
Then they're gone.
We shell them out and they're gone.
Okay.
But what often happens when people have fibroids, they have, let's say, 3 or 4 that are big, but they also have these tiny little seeds of fibroids. You see them in there and you kind of wonder, well, is that big enough for me to dig out? And so sometimes you leave a few little seeds, and then 5 years later, you've got some fibroids again. So I don't know how,
this?
What causes
this?
I don't know. You think that it would be IGF-1, right? You think it would be something that's making things grow, but we can't stop it completely. Not that I know of. I'm sure they're less likely, but some people just have a propensity for making them. I can't really say. And I don't know if there's any real research on fibroids in a vegan community, because there aren't that many vegan communities, right? It's very hard to tell. And I don't think they looked at that in, say, any of the really big population studies. I didn't see any, like in Adventist 2, I didn't see anyone talk about any
fibroids.
Of that, right? Fibroids, no. But it should be studied. Hopefully PCRM will. The lignans in flax definitely will help to get rid of some of the excess estrogen, right? It's the lignans. So I would add some extra flax to your diet. And then just keep an eye, because you also have to just time things about menopause. If you can make it, if your fibroids are stable, they're not growing too big, and they're only like 14 week size, and you can still pee and poop, and they're not really pressing on anything, and they're not hurting, then you can make, if you're 40, let's say, then you can make it to menopause. But if you are 35 years old and you already have a uterus that's, halfway up to your belly button, and you're feeling chronic back pain, maybe you want to do something about it. So there are now a few new technologies for getting rid of them in a minimally invasive way. Okay. They can plug up the blood vessels that go to feed the uterus.
Well, Kathy Cross had a question. She wanted to know, when do ovarian cysts or fibroids become absolutely necessary to remove? And I think you kind of sort of touched on that, right. When you get to a point where it's uncomfortable.
Right. So let's separate issue. So for cysts, if you have even a benign cyst, we talked about cysts last time, right? The follicular cyst and the corpus luteum cyst, the functional cyst, and then the ones that are not functional, not related to the normal functioning of the ovary. So if you have a simple cyst, but it's ruptured and there's bleeding into your belly, and you have a belly full of blood, you have to think about whether you need surgery, because sometimes that blood, the blood will get resorbed, but if it doesn't stop bleeding on its own, then you need help. And I've rarely, but I have once had to operate on a corpus luteum cyst that was really hemorrhaging. So it's rare, but it happens. But if you have a complex cyst, if you have a cyst that has that it's not just a simple water balloon. It actually has solid elements in it, and it's sort of an unusual looking cyst, or if it's quite large and it's not going away, then it needs to be addressed surgically.
Okay.
Right? Because it could be a sign of something that's even malignant or a borderline tumor that's almost. Now regarding fibroids, again, I think most of it, they are usually benign, but not always. So yes, fibroids are benign, but sometimes something that looks like a fibroid, kind of looks like a fibroid, could actually be something called a leiomyosarcoma. So, and you've heard probably these horrible stories about doctors that, there was even a physician, I think she went to another physician, she was a doctor herself, who had her supposedly fibroids removed. Usually it's just solitary if it's a leiomyosarcoma. And they used something called they morcellated it, right? So they went in and churned it up almost like an apple core. And that spread, and it was a cancer, and it was spread all over her belly. So it was terrible. And so now they're not even allowed to do morcellation for fibroids because, you think it looks benign, but there have been times when they weren't. So especially if you have a solitary fibroid that's rapidly growing, that needs to be addressed at whatever age it is. And otherwise, if you've been followed and you have multiple fibroids, and lots of people do, I've once taken out, I think, 28 fibroids from someone's uterus of all different sizes. And you just keep looking for them. They're just all over, yes.
What do you do when you take them out? Do you just cut them out, or do you have to anesthetize first, or?
Well, this is usually an open surgery when they have so many, and you're feeling all over the uterus, and you're feeling over them, and you inject with something called pitressin to get the blood vessels to clamp down so they don't hemorrhage a lot, and then you dig them out. They pop out. They really are encapsulated. They're like these little whorls of fibrous connective tissue that are different and distinct from the surrounding muscle. And so they just kind of pop out. It's kind of fun surgery.
I don't know. I don't watch TV, but I heard somebody talking about the pimple popper. It's kind of like.
God. My cousin is addicted to that. I've never watched that. So the traditional way of treating these fibroids is just with surgical. They can be done laparoscopically. They're not supposed to be morcellated anymore, but sometimes we can make a small incision and get them out laparoscopically, so they're smaller incisions. So it's all about symptoms. If you're having heavy bleeding, if you're feeling pain, if it's interfering with your daily life, if they're so big that you're really not going to be able to make it to menopause without them being you have to think about, am I going to have them out now, or am I going to have a bigger problem in a few years because I'm not going to make it to menopause? I mean, I've taken out a fibroid. We've taken out a uterus in a woman that was that was 20-week size, like a 20-week pregnancy, and one that was even 22 or 24. And there are some incredibly skilled doctors with the laparoscope that can remove an entire uterus that big through 4 tiny incisions. And then morcellate it. You put the whole thing in a bag and pull it out through the vagina, and then cut it up inside that bag so nothing spreads.
Okay.
I've done that.
All right.
Sorry.
Well, TMI. Fran Batzer, who's a very good friend of the 2 Peas in a Pod, wants to know, she says, can you get off, is there a way to stop, after a hysterectomy, is there a way to stop taking the compounded HRT, the hormone replacement therapy? Yeah. Is there a way to stop taking that? Because she said, I went off the HRT for 2 years and crashed my hormone levels, so I went back on them. So what are your thoughts?
Well, in the past, I have weaned people off. So you can go on a lower dose, and then you can start taking it every other day, or you start using it every other day. So I've weaned. It's funny because studies have shown that it doesn't matter. If you look at, I guess, big populations of women who are going off of it one way or another, I've heard that there's no right way to do it. Some people can just stop. Some people like to wean off. I think in general, I've weaned people off. Personally, I was on hormone replacement therapy for a couple of years myself, and I think I did just stop. I might have taken it every other day for a little while and then just stopped. So that's what I would recommend. Just go back up. Because the other thing about weaning is you can get yourself to the place that you're comfortable. Right. Just stay there. And then just stay there.
Yeah.
That's okay.
Little girl.
Yay. So my cousin Pam Mays is watching, and we call ourselves sister cousins. Hi, Pam. Love you.
Hi, Pam.
She just had hernia surgery, but she and I both had cysts on our ovaries. I suffered from polycystic ovarian syndrome, but Pam says, I used to have cysts on my ovaries, but since I changed my diet, she's whole food, plant-based, I don't have them anymore. And
Good
I
for
don't
her.
have polycystic ovarian syndrome anymore.
Yes.
So Dr. Shapiro, do you have something wonderful to say about following a plant-based lifestyle and for ladies who have polycystic ovarian syndrome?
Definitely. So the issue with polycystic ovarian syndrome is that there seems to be more of this chemical compound called advanced glycation end products, and women who in their urine. And advanced glycation end products are found even in vegan food. So there's certainly more of them in meat. So these are compounds. You probably, Jeanne, you probably as a chemist know more about this than I do, but it has to do with the Maillard. It's the Maillard reaction. So it's a way of glycosylating these chemicals inside of you. And so there's more. So depending on how you cook food, you can develop more of these AGEs, advanced glycation end products. So even if you are, for example, roasting potatoes or eating French fries, they're going to have much higher AGE content than than a steamed potato.
I was just getting into this conversation with Dr. Frank Sabatino, and we were talking about this because we were having a conversation about the air fryer. And
right. What did he think about that, about AGEs in the air fryer?
He's thinking that there's going to be a much higher because anytime you're getting the crispiness or the brown,
right.
like
that's
on
the browning, right? The Maillard, yes.
Yeah. So I'm like, don't tell me
sorry.
about my French fries.
So yeah, on the air fryer, everything that goes in the air fryer, I don't look at it as having any nutritional value. It's like a microwave. To me, it's like if it goes in the air fryer, it goes in the microwave, it's purely for pleasure. It's a high heat. Those micronutrients, phytonutrients, if you're putting veggies in there. Who doesn't love air fried potato or sweet potato?
God.
I have not had the honor of tasting.
Oh, they're so good. They're like candy. And then again, it's one of those things that you're feeding that old memory of the French fries. It's not quite like that in any way, shape, or form, but it's close enough that for those of us who've been plant-based for a long time, or even if you're transitioning, it's really good. But again, eating the sweet potatoes steamed that's been heated, at no more than 212 degrees, you're going to have, those starches there, and I don't know I'm not a scientist. I don't know how much percentage of nutrition you lose, but I have read that when my air fryer is set to 425 degrees, there's not much that's going to survive that after 30 minutes. So,
right. And even things like nuts, when you're eating roasted nuts, I know that Dr. Greger has now talked about how now he's getting his tahini and everything raw instead of toasted. It's not quite. You have to wait until your taste buds change because so if you were suffering from PCOS, you really wanted to have a reduction in your symptoms, then you might want to go all out and try to reduce your exposure to and intake of these things that we call AGEs, and that also means changing the way you cook. And you're not a smoker, obviously. There are also some foods that can help to pull the AGEs out of your body. Things like brown rice and mushrooms, I read. And always use a wet heat instead of a dry heat would be better. And having raw nuts and seeds and more high antioxidant foods like spices too. And avoiding all the other endocrine disruptors. All the things we talked about before, the BPA, the parabens, the phthalates, and fire retardants in your furniture, dioxin, PCBs, DDT, hormones in meat and fish, which I know you're not doing anymore. So cleaning up the diet to minimize any preformed AGEs, and then also changing the way you cook so that you actually even have less AGEs as well.
Okay, if you're watching this broadcast, we are all to sell our homes, move to the North Pole, and live in an igloo.
Well, spices.
All of those exposures, it's like, wow, it's too much. But we can't. It's nearly impossible to live that clean of a lifestyle. I mean, we can do
absolutely
90% of it, but I know that diet.
When you can, of course.
Yeah.
This is not about. What I remember. I was watching some of the Esselsons. They have some great videos, and she was talking about how we're plant-based, not plant perfect.
Right. And I love that. I love that. That's so,
That was really good.
but you know, it really truly is, this lifestyle is 100% about the nutrition, but it's also equally important about the toxins, our environment, the glyphosate, like you were saying, those endocrine disruptors, because even though my lifestyle, my nutrition was whole food, plant-based, SOS for years and years, I didn't get off my levothyroxine until I changed my personal care products and made a conscious effort to get as many of the chemicals and change to an organic, buying organic produce. Then we saw my thyroid really start leveling off.
Right. You know, it's fascinating how things can take time. I just want to just share with you that I was unable to tolerate eating any onions, anything in the onion family for decades, even when I was vegan. I mean, it was horrendous. It was horrible, the gastrointestinal distress. And I asked all the specialists, whenever I went to a conference, I would ask them. I asked Gregor, I asked Clapper and Barnard, anyone I saw, I would ask. And they'd always said, oh, and also the guy from True North. And I asked him specifically, I asked if water fasting would help. And he said, no, it's your enzymes from your pancreas and they're gone and that's that. Well, but that's not that, because after it took about 6 years, I've been plant-based for 6 years, and I can eat them now with almost no trouble at all. I can even eat them raw. I can, and it's a miracle. It's a miracle because it wasn't about I don't think it was about my pancreas. I think it was about my gut bacteria. And I think I had to get some species back. And it's possible going more organic, more consistently organic, like caring more about that, maybe eating more at home than eating out. I mean, it was just this process of wanting to be more in control of what I was ingesting and really giving up all diet soda completely.
Yeah, I did that too. I was a bona fide Diet Pepsi holic. I mean, the big goal. Oh my gosh. Oh, I can't.
I don't think I've done it probably for 3 years, but it took a while. I don't know. It's sort of a mystery, but I would just say to anyone out there who's suffering from something, give it time.
Yeah, give it time. You know what's really interesting, Dr. Shapiro, is my husband tried to kill me the other night.
What? Oh,
bona
with
fide.
something that you can't eat?
You know, don't call the police, everybody. I love the man. He did it accidentally. Chocolate. I have been officially allergic to chocolate since I was in junior high, like 7th or 8th grade. I had 2 anaphylactic reactions to chocolate. I've had the skin allergy test, the skin pricks to it. I mean, always got the hive. Well, since I went plant-based, my whole body's been healing, and we were Nick likes to get the Vitamix out, throw the frozen bananas in, and I have a canister of the unsweetened carob powder, organic, and then he has a canister of his organic cocoa powder.
Right?
Yeah. Well, he says, I'm going to go make us some ice cream. So I go, he gets all the Vitamix, everything out there, and he's got his canister of cocoa. And I said, are you making this dessert for you? He goes, no, it's for both of us. I said, are you trying to kill me? And he goes, oh, because I made this the other night with this canister and you didn't die.
Oh my
I had no
gosh,
clue. I didn't know that it was chocolate. It tasted like carob to me because I have not had chocolate since I was probably 13. So,
I wonder if you went back, it would be fascinating if you went back to an allergist and got retested.
I'm going to.
Because that was one of the things they said that as your body starts to change and heal, that you start, allergies that you used to have are no longer there.
I no longer take Claritin. I used to be the Flonase Claritin, get the Kenalog shot twice a year. I was laying in bed the other morning just breathing through my nose thinking, gosh, it's so nice not having to buy the Claritin. And back in the day it was Celdane and all that. And
I took Claritin also every day in Zyrtec every day for years.
Yeah, and my cousin Pam. My cousin Pam's been very allergic to avocados, and she can eat avocados now. So anyway, my husband keeps telling me, let's go get a Snickers bar and you can go to the emergency room and eat it and see what happens. I said, no, I'm not going to do it.
Funny. Very funny.
I'm not opening up that gate. I'm fine. So anyway, it just goes to show you the power of plants. I really think
and even if it takes time. Even if it takes time.
I am going to make an appointment with an allergist because it's not just the chocolate. I want to see everything because Dr. Incado said I had the largest dust mite reaction he'd ever seen in his entire practice. Yeah.
I can't wait to hear.
I know. So I'm going to make that appointment tomorrow. This motivated me.
Cool.
Okay.
I'm glad you're okay. That's a scary thing.
I'm fine.
I used to be poisoned all the time with onions and things, and it was just horrendous. It just went on for hours.
And that's one of the things Nancy and I talk about is that as your body starts to heal, it's almost like you're peeling back layers of an onion that you're starting to realize, like for me, I never realized how salt sensitive I was. And Nancy is, caffeine, a whiff of caffeine. And so,
Yes.
Yeah. I mean, and I never knew that I was so salt sensitive because my body was so inundated with all the crap, that you're just, and you don't realize how bad and how sick you are until it stops. Exactly. And it's amazing, it truly is. I mean, how much our bodies really heal and how much our bodies change. And then it's so sad to see this because the kids are coming in now because over here on the East Coast, we've got the pollen. Oh my God. The pollen's, the plants are starting to come up and the trees are starting to their leaves are starting to come out. So the pollen is coming with it.
Yes.
So,
I talked to some of my patients today who are complaining about the spring and their allergies. And I said, do you have any dairy? Do you eat dairy? So
yeah, dairy's the culprit. I'm telling you, that dairy is bad news.
Yes.
Bad news.
Okay, well, let's get another question up here.
Let's get another question.
So we've got Misty Orlock who asks, how can a whole food plant-based diet help with estrogen dominance? And what are the best ways to reduce? She asked about fibroids and fibrocystic breasts. Initially, after going whole food plant-based, my symptoms improved, but in a few months, they became much worse. I realized I wasn't getting sufficient iodine in my diet, and I started taking supplements. I'm not a fan of seaweed, and I do limit my salt intake. So what do you got from Misty?
Okay, well, first off, I just wanted to say that I really don't know anything about iodine and fibroids. I'm sorry. So I just don't know if there's any connection. I couldn't find anything. What about excess estrogen? We did talk about the lignans in flax as being a way to reduce estrogen. And so I would think adding, let's say, 2 tablespoons of ground flax a day shouldn't do any harm. It would just be extra omega-3s, which would be perfect. And I think that would be something, but for the salt, I mean, you just need a reliable, I think if you have to take supplements, you have to take supplements. You don't even like the pinch of salt, and you don't like even the kelp granules, or I know that I cook my beans with some kombu strips, and by the time they're cooked, they don't seem to have any flavor. I eat them too. So
what do you cook it with?
Oh, it's a kind of seaweed strip. It's called kombu.
Kombu. Okay. I use that too. I put it in I'll just
in
put
the Instant Pot.
In the Instant Pot.
Yeah.
And it's so mild. I like the fact that it gives me some iodine. It's a little salty flavor. It's funky. It kind of bubbles up a little bit and leaves kind of a funky film around the inside of the Instant Pot.
Right.
But you can't taste the seaweed.
No, you cannot.
Not at all.
No,
Not
and
at all.
I eat it you eat it too, right? It doesn't taste. It doesn't taste like nori. It's not that kind of fishy.
Not at all.
Right.
Not at all.
So you don't need it. Right. But I didn't know about any connection between iodine and fibroids, and then lignans and all the other kinds of, we talked about all the other sources of xenoestrogens to try to avoid in your life. But until you're menopausal, you've got those ovaries and they are making estrogen for you. And estrogen does so many good things. It keeps your skin turgor nice. And I mean, I don't know exactly. I don't know if she's still here. If the person who wrote the question is here, if she has any comments about how she experiences the excess estrogen and how she knows that it's in excess or just a normal amount as a woman. I don't know.
I don't know. I don't think she's in tonight. So this is from the last show a
Right.
while ago. All right. Well, let's move on to another one. Elisa Sin, who's also a Simply Plant-Based member, asks, she says, I've had a whole total hysterectomy, and do I still have to go see the gynecologist?
Right. So I love this question because people use the word whole or total hysterectomy, and for OBGYNs, it's not clear what they had. So just to define, a hysterectomy is removing the uterus.
Okay.
And even the word total hysterectomy is removing the uterus with the cervix. A subtotal hysterectomy is, or sometimes called a supracervical hysterectomy, is when they go in laparoscopically and they just take out the top of the uterus, but they leave the cervix.
Mm-hmm.
So it's hysterectomy, but it's a supracervical, above the cervix hysterectomy, or a partial hysterectomy. Sometimes, I don't always know what people mean when they say partial, because that's not a term we use, but a hysterectomy, a complete hysterectomy, is still just the uterus and the cervix. But what I thought maybe this person was referring to was a hysterectomy with removal of the tubes and ovaries, which is called a total hysterectomy with salpingo-oophorectomy. So,
Gesundheit.
yeah, so that means that the
Say that
uterus, the
again.
cervix, the uterus, the cervix, and the tubes and ovaries have all been removed. Now, if you have had your cervix removed for benign reasons, you do not have to have pap smears anymore. But if you've had cervical cancer, or if you had a history of some some sort of dysplasia in the vagina or in the cervix, then you should talk to your doctor about continuing to get some paps. If you had but I still think you need to go for pelvic exams every year, because I'll tell you what, because I once found ovarian cancer in a woman who had a complete hysterectomy with a salpingo-oophorectomy. It was done open with an incision. So they must have they must have taken a pedicle behind her ovary and cut off most of the ovary, but they left a tiny little nubbin, and it grew, and there was actually a cancer there.
Oh.
So I found that. So even though she had total hysterectomy and her ovaries out, I still felt a mass on exam. That's why we do that exam, and that's why we sometimes do even a rectovaginal exam, to really feel that whole part of the pelvis where the ovaries sink. And I felt a mass, and it was an ovarian cancer that had grown out of an ovarian remnant. So
Wow.
I do believe you should still have pelvic exams. Someone needs to look. I mean, you can have, someone needs to look and someone needs to feel. Sorry.
I'm just not gonna lie. I mean, that's just, with your legs up in the stirrup, and you're just like.
But as long as you're there for 5 minutes, they might as well do a good job, right?
I know.
And I'm very appreciative, doctor, that we have doctors like you to be able to do that, because my mom had both cervical cancer and she had estrogen cancer. She ended up having hysterectomy. They left one ovary, and she had it at a very young age. She had it at, I think, 40 or 41. So,
Yeah.
and I believe my cousin Pam was maybe even right around that age or younger. And so, yeah, no, the ladies, we've got to have everything checked down there under the hood, as Jeanne says.
Right. I'll never forget also the reason that we do the rectovaginal exams. People don't usually want them, but after about, your doctor will decide if it's after 40 or 45 or some number, when we really are concerned about ovarian cancer, that a rectovaginal exam is better for feeling the entire pelvis than just a pelvic exam with 2 fingers in the vagina. So you can miss the whole back of the pelvis. And I'll never forget when I was starting my residency, and I was in the oncology department with the chair of the department, who was a tough woman. And she said, "Oh, this is an interesting exam. Go check this woman out, this woman in this room." So I went in, and she had cervical cancer and treatment for cervical cancer. And I was very young. I was an intern, right? I didn't know. So I went in and I was saying, I need to do an exam on you. I did my little exam up here, just 2 fingers, and felt, sorry. And I didn't feel anything. So I went out, and she said, "What do you think of that exam?" I said, "I didn't feel anything. No evidence of disease." And she said, "Did you do a rectovaginal exam?" I'm like, "No." "Get back in there. Do a rectovaginal exam." So I went back in, quivering, and I said, "I'm very sorry, but I need to repeat an exam." And so I did the rectovaginal exam is 1 finger in the vagina, 1 finger in the rectum. And it's yucky, right? It's a yucky for everybody who wants to do it, right? Who wants to have it done.
Yeah, got it.
But let me tell you, she had a shelf of tumor that went from one side to the other side. From sidewall to sidewall, after having all the radiation. It was a shelf of tumor, and I completely missed it by being above.
Wow.
So, because the ovary, everything sticks to the back, so you have to let the doctor, if they feel like it's the right thing to do, don't say no, because I found ovarian cancers, and that's really the way to find them.
So wow, that's amazing. Sorry, Dr. Shapiro, to interrupt, but Kathy Cross has a good question. Why can't they scan you instead of having the probe? Wouldn't a non-invasive scan show the same?
You mean an abdominal ultrasound?
She just says a scan.
No. She said non-invasive.
Yeah, no, I said that. Her
Okay.
words were, I added because I was trying to not make it too wordy. She says, why can't they scan you instead of that? Laugh out loud. She did say, no, wouldn't a non-invasive scan show the same?
Well, if we sent everyone to a radiologist, maybe I don't think all OBGYNs are as skilled, and maybe some new ones coming out of residency. I know when I was at Kaiser, I was sent to a course to become more proficient with ultrasounds. And if I was suspicious of anything, I would send them to a radiologist. So is everybody everyone who goes in for their annual exam going to be sent to a radiologist?
Yeah, but I mean, having somebody stick their finger up you, okay, that's a little bit, okay, it's not that great and comfortable, but it's not as toxic as having, x-rays
radiation.
Well, I think she meant an ultrasound, but the best kind of ultrasound, sonogram for looking at the ovaries would be a vaginal probe ultrasound to really get closer. Again, just to get closer to the mass or closer to your ovaries. So it would still be invasive. And I'll tell you, people do not like those ultrasounds either, because, they kind of press, they go in and then they go to the side and you turn.
Bladder.
It takes longer, right? So the bladder has to be big if they're doing an abdominal. So that's the other thing. If you're having an abdominal ultrasound, then they need to have a very full bladder so you can see through the bladder to the pelvic organ. So I don't think it's a way out.
Yeah, for me, like I was saying real quick though, with having the years and years of polycystic ovarian syndrome, I loved my OBGYN, Dr. Joseph Brooks. Love you, Dr. Brooks. If you do this, but I would have a vaginal ultrasound every 6 months. He was insistent on seeing my ovaries because of the cancer in our family, and ovarian cancer is very hard to diagnose. So I just laid on the bench, put myself in a happy place, and just hummed, like put myself in a whole nother room mentally, and then was very grateful to have decent, always negative results that they're just cysts, everything's fine. But I'll take the vaginal ultrasound any day of the week, because I didn't want the radiation, and I wanted to have that assurance.
Right.
My question to you guys is where do you get that lubricant? That's like axle grease. I mean, that's
there is. Yeah.
I mean, seriously, come on.
It's not a sexual lubricant.
No.
You know what? This whole thing, you just have to realize that all I'm trying to do, and all your doctor is trying to do, is keep you safe. And if there's something that's there that needs to be detected and treated and dealt with, then we don't want to miss it. Nobody wants to miss something. So, I've had people who say, don't put your finger, don't go in there, blah, blah, blah. And that, it's fine. I understand. But really, I'm only trying to make sure that you're safe and that you don't have a mass. And it's hard enough with people's tummies being tense. It's hard enough. It's not easy to do a pelvic exam, there's probably some talk about, are they really, really necessary? But as far as I know, we're still doing them, and it only takes about 20 seconds.
Jeanne, can I interject a question real quick that came to me in a private message, and then I want to also follow it up with a conversation I had with a friend. So we had a lady who private messaged me, and she is sleeping in a separate room from her husband. We're the same age, so she's about 56 years old, because they no longer have intercourse. She didn't realize, just uneducated in what the body does as far as the cervical lining wall thinning, and the vaginal wall is very painful. So they no longer make love. They no longer have sex. And so she said, I have my own room. He has his own room, and we're just like best friends. And I said to her, well, you need to see your doctor first and foremost to have a full physical. And are you menopausal, postmenopausal? And she said, probably post by now. But I said, there's a whole lot of lubes out there for that and medications that you can use. And she was completely shocked that she did not know that this was a naturally occurring event when a woman is postmenopausal. So can you share with us about painful
Yes.
intercourse after menopause?
Yes. So the natural menopause occurs when you've run out of your good eggs that can be ovulated. So if there's no more ovulation, then remember the granulosa cells are not making estrogen. So the decrease in estrogen in your body manifests itself in a lot of different ways. I mean, there's some bone loss, obviously, that sort of happens a little more rapidly when you don't have the estrogen, and you get hot flashes and night sweats. And the vagina, these tissues that are particularly responsive to estrogen change and get thinner. And in the vagina and the vulva, there are changes, really atrophic changes. So it becomes sort of dry. There isn't as much lubrication, and the lubrication is a transudate. It's the cells from inside the vagina that are actually making this sort of this lubricating material, and they really don't anymore. But more than that, it becomes stiff. So stiff and narrow, and if you haven't had babies, then it's a little narrower to begin with. So the stiffness and the inability the loss of elasticity is what really becomes a problem. So in the first couple of years, what you're dealing with is just the hot flashes and the night sweats. And initially, the vaginal dryness is not usually a problem. It takes my experience, it takes about 5 years to develop real enough vaginal changes that it's affecting your ability to be intimate. This is an interesting story of people who decided that they didn't even really care to sleep together, that they lost all intimacy because that's just interesting that was their solution.
Yeah,
because
I know.
there are other ways.
Thought it was.
There are other ways to make love and to be intimate.
Exactly.
But that's fine. That was what was most important, and I don't know what's going on.
And we didn't get into that business.
Okay.
I don't know if they rendezvous or something doing everything else. I don't know.
But you can definitely, especially if you catch it early and not wait. If you're already taking care of people who are 20 years postmenopausal, and then they found a new guy, a new dude, and they want to know if they can get it back. It's kind of hard to get it all back when you've gone 20 years without it. But so that's why we talk about use it or lose it. But you can certainly keep your vagina more open if you have something going inside of it.
I'm sorry. Sorry.
This is my father-in-law is always complaining when I'm around, because we talk about.
No, I love it. We women need to talk about this because I was just so sad that she's not having this making love with her husband. It's
so if she talked to her doctor, they would probably be able to get her on some vaginal estrogen, and vaginal estrogen is safe. They use something called Vagifem. There's Vagifem, little tablets of estrogen that go inside the vagina that get absorbed, that make the vagina more elastic. You can also use a little ring called the S-string or E-string that goes in and stays in for 3 months and emits a little bit of estrogen. And they don't feel like these increase your risk of uterine cancer at all.
Really?
So, no, because it's just a small amount. It doesn't raise, you can even check, it doesn't raise your blood level of estrogen. I've even seen people who've had breast cancer who are able to use vaginal estrogen. Their oncologists say it's fine because it's not. Or are you showing us? What are you on? A little bit of vaginal estrogen, estrase.
Yeah, and it's
so
estriol vag, PBG free. You get it from an apothecary. Is that the right word? STRIOLVAG.
So it's so they've compounded a vaginal estrogen cream.
Cool. Yeah, this is what my gynecologist, who's vegan, recommended. Even though I have such major breast cancer in my family, I chose to not do any type of bioidentical hormones or any hormone therapy, but I am going to use it so I don't lose it.
Right. Right. Because it's hard to get back once you've lost it and continue to be intimate.
This is so inexpensive. This was like $60 through an apothecary, and this will last a couple of months. It's like 2 times a week, blueberry size. And ladies, see your doctors.
Yeah. You just, you really want to stay away from, you want to stay away from Premarin because Premarin is, we're vegans, if we're ethical vegans, and we don't want to use anything that comes from pregnant horses because those forms are horrible. And so there is estrase cream also, and there's also even a pill. I forgot the name of it, but there is a tablet you can take if you don't want to use anything in your vagina. There's a pill you can take that will help with vaginal dryness.
Yep.
It's a different kind of selective estrogen receptor modulator.
Yeah. I mean, I'm an open book, and I believe that I want to share everything I've experienced so other people in this world can learn through me. And that was one of the things that really was prominent after menopause was painful intercourse. And my poor husband, he thought he had hurt me one night because I, grimaced. And then I said, I'm just going to go see Dr. Christine because I know this is, my mom had the talk with me and she knew, she told me, so I knew it was my time, my experience. And I was like, I just wasn't going to mess with it. And just, this is my one and only prescription medication that I use. And I always tell people I don't take prescription medication because I don't, but this is just, to me, is just a cream that.
So what the estrogen, that helps. So what the estrogen really does is it makes the vagina more elastic, but you still may need to use a lubricant because it may or may not feel as wet as it used to. It may not lubricate as much. So it's still not a bad idea to use a lubricant. And there's some really good lubricants out there that are very slippery and slimy and much better than what we use for exams, which again are not sexual lubricants. So there's one called Astroglide. So this is a water-based lubricant that's really terrific. It was actually designed by NASA as a mechanical lubricant, but they stumbled on a sexual lubricant instead. But it's very slippery.
Get Alice!
Right, exactly. So Astroglide is great because if it does get sticky or tacky, if you've been having intercourse for a while, you can just have a little bowl of water and just add some water, and it will sort of rehydrate itself and go for more. There are other silicone-based lubricants. I don't know how you feel about that, Jeanne, but there's some that are incredibly mucoid and amazing. So you can decide what you want to use, but I would encourage you, if you want to be able to have something inside of your vagina, if your man wants to be able to put something inside of your vagina, that you work on that together and don't let it just slip and slide away because it's hard to get it back. Now there is something called a vaginal rejuvenation laser. I had a friend who actually, I think they're actually might be being taken off the market. Someone came to my office and tried to sell me on this thing, and it was going to be very expensive, but they put this little round laser into the vagina and they laser all around it. And they showed me how that's the cells, how the tissue layer got plumper and thicker, but I don't know. It's not something I ever bought into. So I'd buyer beware. I don't know about that. Yeah. But
there's
estrogen,
no laser going in this girl.
Right. But it has to be done every year too. It has to be done every year. So it's kind of, I think it's a racket. But at any rate, maybe some people have had some benefits, and if you sell it, don't kill me. So, but I think the estrogen is a good idea, vaginal estrogen, if you are bothered. And let me just say also, sometimes people, it's not that you can't have intercourse. It's just that people feel that their vaginas and their vulvas are dry. It could be that you have showered with some soap and it just feels really dry and kind of sandpapery, or like it just doesn't feel comfortable. And so sometimes, even if it's not about having sex, it's just about being comfortable. Right. I've seen people need a little bit of vaginal estrogen because they're noticing it just doesn't feel comfortable, and that's okay too.
See your doctors. We have another question. What about a colonoscopy if you're whole food plant-based and have been for a long time, or even if it's just been a short time?
I'm going to jump in on this one for a second because I went through this with my doctor because I had one at 50, nothing, clean as a whistle. Okay. My doctor's pushing me. I'm coming up on 60. And she's like, no, I want you to get it. Get it. And I'm like, listen, with my lifestyle, I've been this way for a long time, and the whole treatment, getting you ready for the colonoscopy is going to disrupt your gut biome big time. Okay. I mean, all of these pieces. And I said, listen, I'm a low risk. And she's like, no, how about we make a deal? And I said, okay, what do you got? She says, try the Cologuard test. All you have to do is poop. Well, I'm a pooping machine, man. I mean, I'm plant-based. I'm a pooping machine. I said, I can do that. I go in for the colonoscopy, and the guy who does the colonoscopy says to me, because I came back, she says, if you get a positive result on this, will you get a colonoscopy? I said, okay. And I only did it because I just wanted to shut her up. Okay, my doctor. So, and the test was not covered by my insurance, and it was not cheap. It was like $600-700.
Wow.
For one test. So I go in, so I get it back, and it comes back positive. It comes back positive, and I'm like going, oh, okay. Now,
And I was worried about her for a long time and was a nagging.
I know.
Have you called your doctor? Have you called your doctor? No. Have you called your doctor? Have you called your doctor? I'm texting her. Have you called your doctor? Have you called Jeanne? Call your doctor.
Scared.
I know. So I finally called up and said, all right, I called my insurance company, asked if this is covered. Yes. Is this part of my deductible? No, it's covered straight through. Okay, got it. I go and have the test done. And I go in to see the doc before he puts me into sedation. And he goes, I would never recommend the Cologuard to anybody. There's way too many false positives. And I'm like, what? Really? That would have been a handy piece of information to have. So, here I am getting ready to go under, and he's like telling me I would never have had that test done. That was too many false positives. And I went in, and there was nothing. I mean, absolutely nothing.
Oh, wow.
Nothing. And that'll be the last one I ever have. So, I don't know. That's my take on it. I mean, if you're plant-based, I mean, my God, unless there's like risk factors or you're bleeding or something else, that's just my take. What do you say, Doc?
Well, I'm conflicted because personally I have a family history of all kinds of cancer, and including colon cancer. So I had one at 50, and then I had one at 55, and I had a polyp, and I was really surprised. But I had just become vegan. It was sort of a year after, right? So we're close to it. So I wasn't too hard on myself. And then then I had to go back again. So I just recently went back, and I had another one. Okay. So anyway, 2 polyps. But I know that Pam, it doesn't matter about me because it's just an N of 1, right? But Pam Popper, who I do respect, she's a little bit more alternative than maybe I am, because I'm more of a traditional, OBGYN. She feels that they're completely unnecessary and that they shouldn't be done. So I think it's fine. You don't, especially if you're low risk, just to do the FIT test every year, and I offer that to my patients as well, so they can get the FIT test or they can do the colonoscopy. So they don't have to. What can I say? I have polyps. I shouldn't. I was very surprised that I did. The prep isn't terrible if you're a vegan. It's just going to the bathroom. It's no big deal.
So,
okay, share your story.
Okay,
yes.
so real quick, I delayed have that colonoscopy at 50 to about 58, and no, not 50, I'm not even 58 years old. It's way out there. Till about 55 years old. And my dad had diverticulitis, and then he was diagnosed with polyps. He had polyps removed, and then he ended up with carcinoid cancer. So I went plant-based when I was 49, and I felt that my colon was probably clean, but up to those 49 years, I was a carnivore in a big way. And so I didn't know if I could eat my colon clean, so to speak. So I thought, but because of family history and whatnot, and the nudging of my beloved doctors, I said, okay, fine. And I was scared hoopless that they were going to find something. And they did. I had a polyp, just one. And it was a granuloma. I'm not sure what it was, but it was small. And the doctor said that it's the slow growing kind that could have been there for many, many years. And that as healthy as I eat, it probably has just been dormant, not growing. And so I did benefit from being very whole food plant-based because it didn't spread, it didn't grow. And this type of polyp is the kind that can turn into colon cancer. So I am grateful that I had my colonoscopy, and I had the best nap when I came home from the hospital. And the pancakes that my husband fed me afterward tasted like heaven. So I had pancakes and went to bed, and it was absolutely, I have no memory of it. So I always tell people, get it done if you had family history, because you cannot, eat or eat your colon clean if you already have a polyp there. So precaution and prevention is absolutely hand in hand.
So we have one more question before we go. So Kathy Cross and Pamela Mays want to know, what is a FIT test?
Oh, sorry. Yes. So that's another kind of, it's not the Cologuard. The Cologuard is supposed to check for cancer cells, cancer DNA, right?
Right.
Boy, I thought that was sort of gold standard, but we don't. So the FIT test is another kind of stool test that you could do at home in the privacy of your own bathroom. You don't have to do any preparation. You just put the paper down on the toilet. They give you some paper, thin paper. You float it almost like a seat cover. It looks like you float it on the water. You poop on that. You take there's a little like a little spoon, like a spatula. Put it in the poop. You don't have to get your hands dirty. Put it back into an envelope and mail it back to your doctor, or take it back to your doctor, or send it to the lab, however they want it. So that's a FIT test. And they should, after 50, actually, if you have a family history of really 45, and if you have a first-degree relative who had colon cancer at 40, you need to start thinking about something at 30. Like if your dad had colon cancer at 50, you need to start thinking about screening at 40. And the problem is, most of us were not raised vegan.
No.
So, right. So things may have been growing for a while. Some of us, I've only been vegan for 6 years, and I was eating all kinds of, I was raised on Spam and bologna. So, and there are lots of chemicals that I've been exposed to. I haven't eaten organic my whole life. We don't live in a completely, right. And vegans, even vegans get cancer. Even the best of us can get cancer. So, but I know if you listen, that Pam Popper is against colonoscopies. So, but I don't know.
It's a tough one, but again, there's a lot of, I believe we have to take things and we're all unique. We're all different. This is something I always say to the people that I coach, that no two people are alike. We have individual family histories. We have individual lifestyles that we don't know if we're heavy drinkers or if we've, lived on, baby back ribs the majority of your life. And, what is, everybody's different. But if there's a test that's not, it's really the worst possible test there is. The preparation is just horrific. But, for me, I was ready to sacrifice 24 hours to know what's my colon looks like. And I just know that it's my responsibility now to keep it pristine, knowing that it's gotten rid of a polyp and a gold seal, so to speak. Right. Now it's my responsibility to protect it. And that is what motivates me to continue with this lifestyle.
And I know that I think Dr. Greger really talks about that colonoscopies are not so great, but he recommends a flexible sigmoidoscopy, which only goes up the left side of the colon. But I actually know one colleague of mine who had symptoms and wasn't feeling well and wasn't doing well, and he had a flexible sigmoidoscopy, and his colon cancer was just a few centimeters past where they went.
Mine was high up. Mine was high up, she said.
It's true that most of the polyps and most of the cancers are in the lower part, but not all. So I think if you're gonna have to do the prep, just look at the whole thing. But I respect Dr. Popper too. So
me too.
It's right. So you do what feels right to you.
Yep. You've got to do what feels right to you, because we're the ones inevitably who have to live with it.
Right. And I was raised on crap food. So I don't think 6 years of being plant-based is necessarily going to undo all of that for me. And I have a lot of cancer in my family. So I'm doing what I have to do.
Ladies, it has been an absolute lovely evening. Thank you so much, Dr. Shapiro.
Thank you, Dr. Shapiro. We want to have you back because, you are going to be a regular. We love our conversations with you. Thank you.
I do too. It's really fun. Yes, I'm willing to talk about.
We need to do this. We need to be talking. We need to be talking open, and we need to be, let us, share these issues that we're having, because sometimes we feel alone as a woman. Yes. But it's always wonderful to have a woman doctor. Seriously. It just doesn't get better than that.
I only went to a male doctor once, and it was very difficult for me. Very difficult. I had to go away in my head. I
was fine. I was okay with Dr. Brooks. He'd been my doctor since I was 21. He delivered both my daughters. So both of them were C-sections. He'd seen it all. He'd seen, the whole ugly and
the whole beautiful.
Yeah. And he was the doctor. He wore his cowboy boots in the emergency room while he was delivering, or in the operating room. And I used to be a cowgirl, and I was like, right on, Dr. Brooks. Yeah.
No, he did not wear his, he wore his outside.
Yeah. With the blue things over it. This is Chico. So
no comment.
No
That
comment.
wouldn't fly that much here. But now they really
Probably
want you
not
to have different
nowadays.
shoes in the hospital.
Yeah, but 33
Yeah.
years ago, I mean, I
Right.
love that man.
Oh,
and
yeah.
I cried
that's
a
cool.
river when he closed his practice, but he had
Aw.
to have a heart valve replacement and whatnot. But
Oh, my
again,
goodness.
I could talk to my doctor about anything and everything. I didn't have a problem with that. So
Aw.
thank
All
you,
right. Thank you.
everybody.
Thank
Good
you.
night, John
Bye.
boy.
Take care.
Bye, Mary Ellen.
Good night, John.
Bye.
Bye-bye.
Bye, everybody.
Bye-bye.
Thanks for joining us tonight.